In 1961, my father walked into a small brick building in Ohio with a broken arm and a $20 bill in his pocket. He left an hour later with a cast, a smile from a doctor who knew his name, and $5 in change. Fast forward to today. That same brick building is now a glass fortress owned by a private equity firm. That $20 bill, it won't even cover the parking fee. Today, the average American birth costs $30,000, and a simple consultation can drain a week's wages. We're told the medicine is better. We're told the technology is worth the price. But look at this. Behind these numbers lies a disturbing truth. It wasn't the doctors who got greedy. It was the system that replaced them. Today, we are investigating the Great Medical Hijack, the moment your health became a commodity and the family doctor became a ghost. If you feel like you're paying more for less, you're not imagining it. You're witnessing the end of an era. Let's look at the receipts. Close your eyes and imagine an America where the most important person in town wasn't the mayor or the banker, it was the doctor. In 1958, if your child woke up with a fever in the middle of the night, you didn't panic about in-network providers. You didn't check your deductible. You picked up the rotary phone and you called a man who lived 3 streets over. Within 20 minutes, he was at your front door. He carried a black leather bag, and he carried the weight of the community's trust. This wasn't a transaction, it was a relationship. According to the American Medical Association, in 1930, 40% of doctors' visits were house calls. By 1950, that number was still high enough that it was the standard. The doctor saw you in your environment. He knew your family. He knew your stressors. He knew you. And the cost? In 1960, the average cost of a doctor's office visit was about $5. Even adjusted for inflation, that's only about $45 to $50 today. Compare that to the $250 you're billed today just for the privilege of sitting in a sterile waiting room for 40 minutes only to see a physician's assistant for 5. The financial structure of that era was simple. The doctor worked for the patient. There were no third-party payors deciding if your pain was reimbursable. If the doctor said you needed a treatment, you got the treatment. It was a high-trust society where the family doctor was a pillar of the American dream. So, how did we trade this world of mercy for a world of billing codes and collection agencies?
The year was 1971. In the shadows of the Oval Office, a conversation was recorded that would change the trajectory of American health forever. Nixon's advisor, John Ehrlichman, was pitching a new kind of business model. He said, and I quote, "All the incentives are toward less medical care, because the less care they give them, the more money they make." Nixon's response was a simple, "Fine." 2 years later, the Health Maintenance Organization Act of 1973 was signed into law. This was the big bang of corporate medicine. Before this, in many states, it was actually illegal for a corporation to practice medicine. It was considered a learned profession, like the law, where the practitioner's primary duty was to the client, not a shareholder. But the 1973 Act changed the game. It provided federal grants and mandates that forced employers to offer these new HMO plans. On the surface, it was sold to the public as a way to control costs. We were told that by managing care, we would save money. But look at the charts. The moment management entered the room, the costs didn't go down. They began an upward climb that has never stopped. Why? Because you introduced a middleman who needed a salary, a middleman who needed a headquarters, and a middleman who needed a profit margin. This was the death of the fee-for-service model, where you paid a fair price for a fair service. It was replaced by capitation, a system where your doctor is essentially paid a flat fee to manage you. Every minute he spends talking to you is a minute he's losing money for the corporation that owns his practice. Ask yourself, when was the last time you felt like your doctor was actually listening and not just looking at a computer screen trying to finish your appointment in the allotted 12-minute window? That 12-minute window was born in 1973. If you want to know where your money is really going, you have to look past the doctor's stethoscope and into the back offices of the modern medical mega-complex. There is a chart that every American needs to see. It's a chart that shows two lines, and the gap between them is the reason the middle class is drowning. Since 1970, the number of physicians in the United States has increased by roughly 150%. That is a steady, logical growth to keep up with our population. But during that exact same period, the number of healthcare administrators has exploded by over 3,000%. Think about that for a second. We didn't triple our doctors. We didn't quadruple our nurses. We grew an administrative army. In the 1950s, a doctor's administrative staff was usually one person, a receptionist who also handled the filing, the scheduling, and the billing. Today, for every one doctor actually treating a patient, there are 16 non-clinical workers. 16 people who never touch a patient, never write a prescription, and never perform a surgery. They are the coding specialists who figure out how to bill your insurance for every single gauze pad. They are the compliance officers who navigate 10,000 pages of federal regulations. They are the marketing directors who buy billboards for the hospital's brand. And every single one of those 16 salaries, their health insurance, their 401ks, and their office space is paid for by you. This is the administrative cancer. It's a layer of lifestyle fluff on a corporate scale. We have built a system where the paper pushers make more than the lifesavers. And the tragedy is, all this management hasn't made us healthier. It has only made us poorer. We are paying for the most expensive middle management in human history and calling it healthcare. If you've ever felt like your doctor was more interested in clicking boxes on a computer than looking at your face, this is why. He isn't working for you anymore. He's working for the machine.
Have you ever wondered how a hospital decides that a single aspirin tablet costs $25? Or why a plastic bag of salt water, an IV drip, is billed at $800 when it costs less than a gallon of gas to produce? The answer is something the industry calls the charge master. In the 1950s, prices were transparent. You knew the cost of the room, the cost of the surgeon, and the cost of the medicine. It was a vintage American market where you could compare prices. But today, every hospital in America has a hidden book. The Charge Master is a massive digital master list containing every single item and service the hospital provides. But here is the catch. The prices in this book are not based on reality. They're arbitrary. They're inflated by 500, 1,000, sometimes even 2,000% above the actual cost. Why would they do this? It's a game of financial shadows. The hospital sets the price at 10 times the actual value, so they can then negotiate a discount with the insurance company. The insurance company feels like they got a deal, the hospital still makes a massive profit, and the only person left in the dark is you. If you don't have insurance, or if you have a high deductible, the hospital tries to charge you that charge master price. It's like walking into a grocery store where a loaf of bread is marked at $50 just so the store can tell a preferred member they can have it for $5. This is economic fluff at its most dangerous. It's a system designed to be confusing because if you actually understood the math, you'd realize that the high cost of modern medicine isn't a necessity, it's a choice. We've moved away from a system of fair value and into a system of price gouging, hidden behind a curtain of corporate complexity. But there is one more piece to this puzzle: the medicine itself. In the mid-20th century, American pharmaceutical companies were focused on cures. Think of the polio vaccine in 1955 or the discovery of life-saving antibiotics. These were monumental achievements that were meant to be distributed to the masses for the betterment of society. But in the late 1980s and 90s, something changed. A law was passed that allowed for direct-to-consumer advertising. Suddenly, instead of your doctor telling you what you needed, the television was telling you what to ask for. The patient was transformed into a consumer. Today, the United States is one of only 2 countries in the world that allows this kind of aggressive drug marketing, and the results are exactly what you'd expect. We aren't just paying for the chemistry, we are paying for the multi-billion-dollar marketing budgets. Compare a vintage 1960s pharmacy with its simple jars of generic compounds to the modern pharmacy of 2026. Today, we have a pill for every ill. We have moved from a model of curing the patient to a model of managing the symptom. Why? Because a cured patient is a lost customer, but a managed patient is a customer for life. This is the ultimate financial nostalgia heartbreak. We traded the simplicity of health for a subscription model of survival. So, what is the real cost of losing the family doctor? It's more than just the numbers on a $10,000 receipt. It's the loss of a society where you were a neighbor, not a claim number. We have traded the warmth of a house call for the cold efficiency of a corporate spreadsheet. But by looking back at vintage American life, we start to see the truth. We realize that the high cost of living today isn't an accident, it's a design. If you've seen this change with your own eyes, if you remember when a medical bill didn't feel like a death sentence, then you are not alone. Join our community as we continue to peel back the layers of the world they took from us. Hit the subscribe button and click the bell icon to join our next investigation. And before you go, look at the comments. Read the stories of those who remember a better way. Because the first step to fixing the future is remembering the past. I'm the voice of vintage American life, and I'll see you in the next one.